846, 95.3 WBCK, Monday morning. If you have pain, and pain anywhere, that's no fun, but you have pain in the joints, it certainly can limit what you're willing to do if you're having to live with that pain. We're going to talk about that right now and what perhaps you might like to know about a special event coming up that addresses that. Dr. Barry Collins is an orthopedic surgeon with Bronson Orthopedic Specialists, and he joins us this morning to talk about that. Good morning, Dr. Collins.
Good morning. How are you?
Very well. Thanks for your time today. We'll give some details on this special free program you have coming in March in just a moment. What are some of the causes of joint pain?
Well, there's lots of them. General wear and tear of living is probably the biggest one, but you can also get it from different injuries. You can have arthritis. There are things like autoimmune diseases, such like rheumatoid arthritis, lupus, psoriasis. All those things can give you problems with your joints. There's also a lot of different metabolic disorders that can cause problems with your joints as well.
All right. So what about treatments? There's probably some out there, right?
Oh, lots and lots of treatments, actually, from real simple to real complicated. First thing, generally I tell my patients, use ice, rest it, use compression, anti-inflammatory medications, things like Motrin and Aleve over the counter are very helpful for this stuff. If those don't generally work, that's when they end up in my office. We talk about things like steroid injections. There's some gel shot therapy that we can use that helps kind of lubricate the joints, things like physical therapy. So there's lots of different things that we can do before we ever talk about surgical interventions, obviously.
Now, if a person has tried all the non-surgical options, what next then?
Usually we start fairly simple. Things like arthroscopy, which is what most people would consider a knee scope. It's outpatient surgery. You come in, go home same day, a couple little poke holes, and we can clear up a lot of the simple things. There are different correctional osteotomies. If you've got a bad angulation of the tibia or the femur, we can correct those with some bone cuts. There are partial and total joint replacements for most of your major joints at this point. Those are all things that we can do when we talk about surgical intervention.
Some folks are nervous about that when it comes to joint replacements. My dad is one of them. He had knee replacement done recently, was trepidatious about it. Now you could probably stand him up in the town square and he'd be an endorser for it. But still, folks get nervous when you talk about that kind of stuff. What can you say to help calm their fears?
Well, the first thing, one, if you know somebody who's had one, that's probably your best bet. Go talk with somebody who's had that replacement. They can give you all the fine details about, what it feels like, what kind of things they had to do to kind of get around it. You can obviously come in and talk to any of us about the procedures. We can give you lots of details about that. One of the things that people don't realize is the life expectancy on these joint replacements now are up over 30 years. So that's one of the big relief for a lot of folks. Like, you don't have to worry about having another one of these done. If you're over 65, we can probably do one operation, and that will do you for the rest of your life.
Mm-hmm.
Also, pretty low complication rates, less than 1% across the country for most joint replacements.
And you're planning a special session on March 16th that addresses this. It's called Joint Pain Causes and Pain Relief Options. How can folks sign up for that?
Oh, it's fairly easy. The program is free, and it's open to the public. There's a complimentary lunch at 11:30 there, followed by my presentation on joint pain and some of the treatment options that are available. There will be time for questions as well once we get done with the lecture. Registration is required, so you have to go to bronsonhealth.com/classes or call the Cool Community Center, and that number is 269-441-0948.
And that's where it will be at 11:30 on March 16th, the Cool Community Center downtown. There's more information on knee and hip pain and that sort of thing, or maybe to make an appointment. Folks can find that, right?
Sure. They can go to our website. It's at bronsonhealth.com, or they can call our office, which is Bronson Orthopedic Specialist, to make an appointment. That number is 877-704-3133. That's 877-704-3133.
All right, Dr. Barry Collins with us today from Bronson Orthopedic Specialists. Again, this event is called Joint Pain Causes and Pain Relief Options. It's to be held at the Cool Family Center on March 16th. That's a Thursday at 11:30 in the morning. You are asked to register in advance, so go to bronsonhealth.com/classes to register, or you can call the Cool Center at 441-0948 to do so and get more information. 852, 95.3 WBCK. Thanks to Dr. Collins for that update as well. Now, weather today.